Hello, this PowerPoint will cover some of the recent developments and give you information on the New World Screwworm. It's certainly something that's caused a lot of stir in the news lately, but we're going to go over some of the history and also some of the clinical signs and things you can do to prevent it. Just looking at history real quick, you can see that New World Screwworm was here back in the United States back in the late 50s and 60s. It was eradicated. You can see where was moved back down through eradication efforts with the sterile insect technique back down into Panama. But recently, everything has started moving back northward. And actually, now there are cases as of June 9th, 2026. There are 6 cases reported in the United States. Um, These actually are very close together there in Texas, a couple of calves with naval infections. Um, this was a dog that had been traveling down into Mexico, came back up, and there were some goat and other calf and dog cases reported. So, roughly 6 cases reported in the area in Texas and the United States. So let's go over some of the organism and the impact, why this is such a problem. Of course, this is an animal well-being, welfare issue because this fly burrows into live tissue and eats live tissue. And then, of course, great economic impacts to eradicate efforts to eradicate this fly. And um, you can see here, this is the fly here, very similar to a house fly in size but some very distinguishing features. You can see the large red orange eyes, also the blue metallic thorax there, and some very distinct dorsal markings there along its back. So that is one way to be able to recognize this insect, this fly. We also believe that because this fly is very similar to a house fly, that this fly can go travel large distances. Also, the life cycle is not very long, only about 3 weeks. So, what is the New World screwworm? It's Cochlea hominivorax. That is the fly. It lays the larva here, and you can see the larva right here has biting mouth parts. This is what burrows into live tissue and certainly quite painful. The mouth parts remind me of the handlebar mustache. You can also see here they very particular ridges that it has makes it look exactly like a screw, so that's why it's called the screwworm. But it infests any warm-blooded animal, and therein lies the big problem: is it can anything. Feeds on living tissue, so it's quite different than the typical blowfly that feeds on dead tissue, and of course causes myiasis fly strike. So who is at risk? Certainly all, as I just said, any warm-blooded animal. So pets, dogs, cats, livestock, horses, cows, goats, sheep, wildlife, deer, raccoons, any sort of wildlife. And then, of course, humans as well. Even though it's rather rare, um, it can infect humans. Okay, there was a case actually reported last year of an individual that had traveled to Central or South America, then back, and it was found once they returned back home. Also, this fly takes advantage of very small wounds to lay its eggs, and it will lay anywhere from 3 to 500 eggs. The female fly only mates once. Of course, the male fly will mate multiple times, but the female mates only once. And that is the basis behind the control program of the sterile insect technique, is that the male flies are irradiated, the pupae are irradiated, and then the male flies that result from that hatching will then mate with the females, which results in a sterile mating, and she's not able to lay any larvae. And eventually they die out because her life cycle is only, like I said, roughly 20-ish days. But she will take advantage of a small wound and will lay just hundreds of eggs on that small wound. It could be as small as a tick bite. So those eggs can easily be there if animals travel, if humans travel, and then, of course, if this fly lays her larva on wildlife, that wildlife can easily move miles at a time. Or if they lay on birds, of course, those birds can travel miles at a time. So almost everyone is at risk for spreading this disease and being affected by this disease. So how will you know if that animal is infected? Of course, maggots in the wound, but these will be very specific maggots. Uh, Notice they burrow. Remember I said they burrow in? That is actually their posterior end that you see in this lower right-hand picture. That posterior end that is facing upward, and the breathing tubes are on the posterior end. And of course, notice how they're in a row. So they can either be in a row like this, or they can just be piled on top of each other. And actually, it's reported that other maggots can be on top of the New World Screwworm. So it's important to report any kind of maggots that you might see in the wound. The animals will be acting painful. They may be isolating, itching, rubbing. They may be off feed. They may not want to eat. They may be depressed, dull. The way it's been described is the wound will have discharge and a very foul odor, described as death with infection. It is, I understand the odor is very, very foul. And of course, wounds that may become deeper or larger. So any of those type things are things to be paying attention to. And it's extremely important, and it's being recommended by USDA, by veterinarians, others, to monitor your animals, put your eyes on that animal at least twice a day to make sure that none of these clinical signs show up, because it can happen very rapidly. So let's prevent it. Fly repellents, because this is a fly that's closely related to the housefly, will be most repellents will keep this fly, as in a knockdown, will keep this fly off the animals. But there are concerns with resistance. So be diligent with your fly control, but not excessive, because that excessive application of fly repellents, pyrethroids, organophosphates, others can certainly cause resistance. Recognize it. Recognize those signs that we just saw, that we just described there. Your animal acting odd, that odd wound on that animal, terrible smell. Report that. Report it quickly. You can report it to your local veterinary medical officer, USDA APHIS agent, or TDA. And here's the number for TDA. And they are all um, very welcome to any sort of reporting, even if it doesn't turn out to be screwworm. They want to know. They want to be able to help you. They want to be able to stop this. Some of the treatments that can be done by a veterinarian, and these are USDA, FDA conditionally approved. That's why the CA is there. These are conditionally approved for livestock. So here's a website that you can go to visit and read about this conditionally approved product. And because it's conditionally approved, you need your veterinarian's approval to use it. If you just up and reach and use it by your own, that's extra label drug use, and that's not allowable. So I strongly recommend you consult with your veterinarian before using this product. And once again, um, not overuse, a judicious use where you're using it properly and not using an extra label, because once again, we can cause resistance. Also, another one that can be used is Exult CA. This is a approved product for a pour-on for livestock. And once again, conditionally approved, so you must work with a veterinarian to be able to use this. For pets, once again, emergency use is authorized for treatment and prevention. And this is for small animal Credelio. It is a flea repellent, can be used on dogs and cats. So this is once again something that you'll need to consult your veterinarian to be able to use this. Some websites that you can go to and visit. These are some great websites. Um, I strongly encourage you to use these if you need more information on New World Screwworm. And just in closing here, uh, once again, just be diligent with watching, just keeping a watch. Hopefully, it will be controlled in Texas. We won't have to worry about it up this far. Uh, Cold weather does repel this insect, but so hopefully it will be contained in Texas, won't come this far. But if you do have questions, there is a website that you can go to. You can go to this website and enter in your question in an email. It'll send it to me, and then I can respond to your email. So certainly, if you have questions, please don't hesitate to send questions. Thank you.